The Pediatric Hydrocephalus Foundation has partnered with the Harris Lab to create a series of awareness and educational videos on hydrocephalus. In this video, Dr. Harris will explain to us how a shunt failure is detected.
The second question is, how is a shunt failure detected?
Often a clinician will start talking to you about some of the symptoms that you're feeling. So if a patient is starting to feel dizzy or vomit, starts having a really bad headache that doesn't go away with just laying down, the surgeon can and clinical team can get some imaging, and this really helps with diagnosis. So a MRI or a CT is the primary method that they can see if the ventricles inside your brain are kind of larger than we would expect them to be. So here you can see an MRI. If we want to orient ourselves for a second, we know that we've got our nose up in front, got our ears on the side, and this would be the back of our head. This white part's the skull, and then this part is our tissue, all of our brain tissue. And this black part inside are the lateral ventricles. Sometimes in MRI, the ventricles will be black, sometimes they'll be white. It just depends on what kind of MRI is taken by your clinical team. But you can see the ventricles, they look kind of big, more plump than they should typically be. And you can see this sometimes best on MRI or CT, and they will know that what's best in that regard. Sometimes also a shuntogram is done where we put some dye in and we try and see if there's a blockage in the system. But generally speaking, we look for symptoms as well as scans. Mom and dad and family are certainly going to be some of the biggest advocates. If you know that your son or daughter is having a lot of consistent pain, then certainly that's a time where you can advocate for your child, because those symptoms are really probably the biggest tell for any kind of problem with your shunt system.
And maybe I'll just add that if you are wondering if you have a shunt malfunction as a parent or a patient, if that's a question, seek medical attention. Call your neurosurgeon and verify and make sure everything's okay. Don't try to guess with the video. Seek professional help.
Absolutely right.
The Pediatric Hydrocephalus Foundation has partnered with the Harris Lab for this video collaboration. The Harris Lab is located within an integrated biosciences center of Wayne State University. The PHF would like to thank Dr. Harris, Principal Investigator, Chris Roberts, fourth-year PhD Chemical Engineering student, and Aaron Gonzalez, second-year PhD student of Chemical Engineering and Materials Sciences. Learn more at hydrocephaloskids.org.